everything under God. And from my viewpoint, there's a miracle happening not only in Alameda County, but throughout California and in the nation in the public mental health system as they're transforming the system to a recovery vision. After 100 years, the public mental health systems throughout this country are starting to recognize and work with and value the importance of spirituality and faith communities in helping people with mental health issues to recover. And as we honor Reverend Jasper Lowery and Veronica Lowery's God-given gifts and their God-given purpose to help people with mental health issues and other disabilities, we're going to get a glimpse of that miracle. And to get the full 10 years ago, says our goal is to empower people by building and revitalizing strong communities through housing, healthcare, and relationship development. Over the past 10 years since they started, the Urojas Center has housed hundreds upon hundreds of people that are homeless. And they have also have right now residences for 89 people. All of that with no government funding. Over the past 10 years, they've fed hundreds of people and helped people get access to health care, again, with no public funding. Over the last 10 years, they've helped people to get jobs, they've hired people, they've utilized volunteers, they've helped people to have a sense of belonging, a sense of community, a sense of family in their ministry. Did I mention without funding? In their brochure, in the invitation, it says, "Come partner with us as we rebuild our community one person at a time." One person at a time. The power of the personal story, and I actually asked Sharon if it would be okay to share this. Sharon Keene, who's been my main partner to work on transforming the system in the last 9 years, very beautiful, hardworking, dedicated person, went through a major mental health crisis in December and January. And there was a time during that, we worked together at behavioral health care, there was a time with that where I said she needed to take a week off. And when she came back after that week with such amazing turnabout, the way she was, just like her old self, compared to the struggles that she was going in just the week before. And I asked her, what happened? Did you have an aha experience? What was the thing that really turned it around for you? And she said she went to Reverend Lowery's church service on Sunday, and that was the turning point for her. So my grandmother's from Missouri, so he thought to show me. So I actually went to Reverend Lowery's service, not one time, not twice, but actually 3 times, with my wife Susan, who's the one that really lets me know if things are on target. And I have to share with you, it was like going to a Polo Consumer Champions event at its best. At its best. And people know from the Polo Consumer Champions, at its best. And I have to say, to be there with so many people that have disabilities, that's their ministry, serving those folks, and to see the people being focused on not on their strengths, not on their disabilities, and there's a number of them here tonight, to see the way that they participate in that service, in leading the song and doing the testimonies and setting it up, was really something powerful to see how belonging to a community, belonging to a faith, really is critical for helping people's recovery. And so many of us that have had mental health issues, we know that. We know how important for many of us belonging to a faith, getting our spiritual realizations taken care of, is key to our recovery. We heard this beautiful person share that tonight as well. So I came away a believer, and my wife insisted we keep going back, so we'll be going, and I want to go back, of course, too. And so I wanted to close, and I actually was hoping that Gigi would present the award, and because she knows them even better than I do, and she's been working with us. But I wanted to say something in closing that would be the most meaningful. I want to say something.
When I was 24 years old, I was licensed as a care provider for the developmentally disabled. And at that time, well, they still don't. We couldn't mix the developmentally disabled for obvious reasons with the dual diagnosed and the mentally ill. And we would always get these calls, and I felt like you can't just turn people away because of lack of stipends and lack of funding and lack of, ways to support themselves. So we would always have our licensed care home, and then we would have homes where we would help the mentally ill. And it was just something that we knew needed to be done. I never thought of it as a business. I never thought of it that it would be something like this today, that we would be getting an award for it. It was just the right thing to do. And I just believe that life, life is to be enjoyed, and so many people need to be led to live life and live it in its fullest and live it abundantly. So we've just been doing that. God has provided ways for us beyond money. And although we know money is needed, He's just always provided and made the ways, connect and happen so that we could provide for these people and show them more quality style lives. Not that everyone we encountered didn't have a quality life, but for those who didn't, He provided. So I'm just honored. I want to say thank you to Alameda County and Behavioral Health, because this is truly a privilege and a blessing to be here this day receiving this award.
This with me. Live, work, worship. That's all I understand. 80% of my congregation live with me, so to speak. So we only got 116 people, 80% of them live with me, so to speak. What am I saying? We help them to live independently. We make sure we monitor where they stand. We may vouch for the rental. We may vouch for the deposit. We may vouch that they are there, and then we put community coaches around their house. No drug dealing. There's not going to be nothing going on there but you living, going to your program, or whatever you need to do. Somebody's going to be in your face all the time or living in that house with you. So those are some of the type of things we've developed. And then it just kind of got out of hand as more families came, so on and so forth, and it just stretched out today. That's where I'm concerned. Because the key to what we're trying to do in the community is in this room. The key to everything they're talking about, in this violence and everything, is in this room. I got 4,000 people in District 1 homeless. 50 to 60% of them have mental health issues. All right? That little back truck pulls up to a few of our residents. I'm starting to understand how this works now. I'm like, those are the ones that bring them little lunches. I didn't even know the intricacies of how the county was doing business. You understand? But yet we have been a part of the process. So in that, it's good to now, coming tonight, I've learned so much about what the agencies that were commended here do. I learned that from being right back there just then. So now I know that I need to come alongside of and work along with the existing people that are already pushing it on this same level. And that's how I think we'll bridge the gap with what we're doing. And I don't mean to be so long.